My name's Braelyn, and thanks to everyone that's here in person and everyone that's here virtually. I'm 23 years old. I was diagnosed with CRMO when I was 17 years old, and I'm fully transitioned to adult care now, so I'm happy to talk to you guys today about how to get through that process smoothly.
My name's Faith. I am 21 years old. I just transitioned like a month ago, officially. So, I was diagnosed when I was 7 with CRMO. Had symptoms when I was about 4 years old, and yeah, I'm just stoked to be here today.
So, what we have set up today is a handout, it's a little brochure, and I'm going to go around and hand it out to y'all that are in person, but then it'll be shared with everyone who's virtual after everything today. And it has a bunch of details in it that Faith knows a little bit better than me. And so she's going to help us walk through those things. But we also wanted to kind of keep it open because this is a multifaceted process and everybody can have different main concerns. And so I think we want to leave it more like a question and answer type setup.
First off, what's really important knowing is the difference. So what most kids start out with is they start in pediatric care, and then once you reach 21, you transition into adult care. You can't stay in pediatric care your whole life, unfortunately. And I think it's important to really talk about the differences between the two and how you get to adult care. So that's kind of what our first page is talking about, is what the phrase transitioning kind of means and what it can look like for people. And I think a lot of the times people think about transitioning as just a solely just when you turn 21, that is when you transition. But transitioning occurs throughout your whole pediatric care experience. So I think that's kind of what this brochure is focusing on, is kind of how to prep yourself at any age.
Before your doctors officially switch.
Yeah, before you officially hit that point. And then that will make your transitioning process a whole lot easier. And a lot can happen a little bit maybe more smoothly for yourself as well. So that is kind of where we start. Kind of on that first page, again, on the left, it says just knowing your medical history. That is, I think, where our foundational key to success starts, is knowing, what's going on in your body, knowing what your disease is, how to talk about your disease to other people. Those are really, really important to help you for the rest of your life, not in just your medical care, but, in your communities and with everyone, with your friends and family.
And because, so many of us have really different CRMO diagnosis stories. Some of us have more time to figure out what our medical history even is. I'm glad that both Faith and I are here because Faith had an earlier diagnosis than I did. But I think that if you get a late diagnosis, you get really good at talking about your symptoms too, because you're trying to find an answer, right? So knowing your medical history and being able to communicate that effectively without your parents is the main goal. And I don't think I got good at that. I was trying to find a diagnosis for about 5 years, and I don't think I got good at that until a year before I got diagnosed. It takes a lot of practice, and I still have to practice every day. So for me, what that looked like was like taking notes before my appointments. I would write down every medication that I'm taking and when I take it, what the dosages are. I would write down what I'm doing to take care of my body, like I'm doing yoga 5 times a week, or I go on walks every day, to share my physical care. And then I would think through, where are my pain spots right now, and where would I like them to kind of focus when they get that MRI? Like, can you check this spot right here? Those are all things that I do right before my appointments, and I walk in with a sheet of paper and I pull out my notes and I say, okay, these are my notes. And I don't think we should feel ashamed about having notes on a computer or a piece of paper. Like, it's okay to not have them memorized. It's a lot of information. So
Yeah, I think that's a really good point. Is finding resources that help you, through your transition is going to be really key, and finding those sooner rather than later, is super important. Yeah, I think that was a really good point.
Thanks.
I think we can kind of open it all the way and look into that middle. We those kind of what you just were talking about, like knowing your symptoms, writing down before you go into your doctor's appointments, or even like, specific points about your MRIs that you want to know. Those are super great things to know. So kind of that timeline we've got starting at 12, but honestly, this could happen whenever you get diagnosed at any age. And it just starts with, your symptoms and knowing your doctor's name. Those are super key to your medical care. So those are really important. And we kind of got it broken up into what do you need to know in your timeline and what do you need to do. So that first do is really critical, is asking questions. It can be really scary. I still get really nervous asking questions at my doctor's visits because I'm like, oh my goodness, I'm standing in front of this person that's so smart.
So serious.
Yeah, so smart and knows so much. But they're just trying to help you as much as they can. So asking questions is super important. And then Seattle Children's uses My Chart, which is kind of like where all of your medical files and data is consolidated online. Other places might use other different resources. So knowing where your medical history is kept.
And the password to it.
Yeah, the password, your username. Knowing where that, where you're going to get your blood tests, where you're going to get your MRIs, maybe if you can have access to those things, will help you, transfer those to your adult rheumatologist eventually at some point. So luckily, Seattle Children's makes it really easy with My Chart. And then kind of further down on the timeline, we've got knowing your medications, their purpose and their side effects. And then again, that communicating your health condition to your friends and family, practicing that whenever you can, just like Braelyn said. I feel like I had a lot of practice in school just with my friends. I talked about it a lot because I was on crutches. I was on an index brace. I was, coming in with masks because, the medication I was on was, suppressing my immune system. So I was getting bombarded with questions all the time. So talking about it in a really comfortable and simplistic way for anybody to understand gave me a lot of practice to communicate that with people. So that's really, I think, key to helping you just throughout life. And then the do on that one, once you can kind of get a handle on what your medication looks like, that is ever changing. I will say that. Yeah. Is that, a lot of us cycle through a lot of different medications. So it's totally overwhelming. Totally okay if you don't know. But once you kind of can get a handle on that, that is awesome. Knowing the medication you're on, knowing what it's doing to your body and how you can, obtain it, whether that's a pill, whether that's infusion, whether that's an injection. The sooner you can do that by yourself, the easier it will be when you turn into an adult. Because it's still hard. It's still hard to know, whether your insurance is going to take, your medication or when to schedule your injections. And it's always easier to do that sooner.
I found it personally simpler to start with the pills. Because, you can put them in the containers. I always buy the cute ones. I have like a Hello Kitty one that makes me really happy. I don't like taking my meds, so I try to make it fun for myself. And so I made a routine, and I started with my mom at first. We would both sit down and we'd pull my mind chart up and we would take out all the bottles and then put them in for each day. And then I would set a reminder on my phone or my watch, and I would start with those pills first, and then my mom would manage infusions and the more expensive Humira injectables. And then when I got a little bit older, I transitioned to those more really expensive medications that honestly require supervision just because of how sensitive they are. But yeah, I think pills are a great place to start, and maybe not all of them, maybe just one, especially depending on how overwhelmed you might feel.
And that doesn't even have to start with your official chromo medication. It
Yeah.
can start with vitamins. Like
Yeah.
you start with, I had to take like a stomach soothing pill before a lot of my medications, and so starting with just that and knowing that what it is and what it's going to do for you.
And if you take it wrong, it's not highly consequential.
Yeah. Yeah, that's a really great one. And then further down we've got your 16 to 17. This is when you kind of can start to be a little bit more independent in your medical care, knowing your medical history, maybe your allergies as well. When you go in for infusions, sometimes they'll give you one of those allergy bans. So knowing, what medications or foods or whatever it is, what you're allergic to, is really important. And then just kind of what Braelyn mentioned earlier is asking your doctor those questions. You can also ask for, maybe some time just alone with your doctor if that's more comfortable. If there's a certain question you have that you want to ask, that is always a possibility. And you totally can be confident in knowing that that will help you and help your own care. And you're just trying to do whatever you can to support yourself and create a little bit of independency for the future.
Yeah.
And then we've got on that one is make sure that you have your own personal medical file. This can be really key and really crucial, especially if, let's say that one place that you had all of your medical files on goes out, and let's say the internet goes out or something, and you don't have those things. So maybe keeping your own little folder for yourself of like, this is when I always get a piece of paper. Dr. Zhao always prints out a little after visit summary for me, and I always keep those in a nice little folder. So if you get a little after summary visit, or maybe you could ask your doctor to print you out one, that's always really helpful. Anything you could write little notes for yourself. Sometimes I'll just write like a Word doc, and I'll be like, today I had some pain in my left ankle, or today I, had an MRI and my pain was a 3 or something. Like even just small notes like that can be really helpful when, transitioning to an adult provider and saying, hey, these are, my bolded things on my timeline.
Yeah.
So I need to be better about that myself, because, some people's journeys are longer, some people's are shorter. And so, but anything you can do, again, to help support yourself in your medical care is really important. And then let's see what else we have on there. Make sure you have a medical file. You can kind of start to think about insurance, and maybe ask your parents and have a talk about, hey, what's
the company?
Yeah, what's the company?
What's the VIN number? What's the group number? All of those things.
Yeah. Is my, medication covered? And, finding out how much your medication costs. Like, those are all really important things to think about. Not necessarily, you don't have to, like, fully get the, everything dumped on you all at one time, but just starting to think about it is really important. And then 18 to 21, again, getting to know your insurance a little bit better, super important. And then kind of maybe looking by yourself for resources that are related to it's kind of blurry, so it's a little bit difficult to see, but knowing the resources that are related to your condition, to your community. Really great one is the Kayla's Comfort Walks. That I feel like has been a really great resource for so many years for the chromo community. It's super fun and it's worldwide, and so that's a really great organization that has been provided for a really long time. The Facebook group is also, if you ever, get to that point where you're like, I kind of want to look into this myself and see what people are posting, because people always have personal stories and questions, and they're talking about events and, meeting up, and you can get to know people there. So just being able to do that independently can be really beneficial and feel supporting and comforting, knowing that you have other friends out there for sure.
Yeah.
And then we've got that final stage of like finding an adult rheumatologist, which can be daunting for sure. But it is not. It is okay. There are resources and there are people out there that are doing the work. And Chromo every day is getting to be known more and more, which we feel really lucky that it's, it's being brought awareness to. Mm-hmm. So here in Seattle, there is like Dr. Zhao has done a really good job of making sure your transition is really smooth. So there is an adult rheumatologist in Seattle that is specifically works with chromo patients. I'm sure there are others around the world as well, but there always is, doing your own research and just looking up rheumatologists by yourself. That kind of goes into some of the questions on the pink side next to us, is what kind of adult provider do you want? You kind of get to start thinking about the things that you want yourself, and kind of the person that you want to take over your own care for. So that's, I think, just thinking about those things, asking yourself, what kind of doctor do I want, and doing the research. So looking up who their patients are, maybe looking at about their, their own history, and just doing your best to inform yourself about the people and the communities around you that can help you, can be really helpful. So,
what time is it? 10:28. When does this break out? 10:55. Okay.
Got a little bit of time.
Do you feel comfortable? Maybe we can move into that question.
Totally. I was going to say, I feel like that wraps it up. So
yeah, beautiful. Okay, great. So if questions about learning about insurance or questions about finding doctors in your area, if you're concerned about that, because honestly, that's really valid, and that was one of my biggest concerns. Just anything you guys are wondering.
Yeah. I think this is awesome. I can't wait to show it to my daughter. I think it's really easy to explain to her. I really love this. It's so cool. I had a question about mental health and maybe helping, since you may be going away to school, you're not right there with your parents. Mm-hmm. Some of your insurance will include a certain number of counseling sessions, but how do you, get the help that you need mentally through all these different ages? Mm-hmm. And then also I think a good resource would be helping your child before they leave address medical gaslighting. So what are some phrases you can use? Who can you look for in the community that will help you address this? And how can you go in where you can build a rapport and get the
you kind of have to prove yourself to these doctors.
And it's so frustrating.
Yeah.
So I think this is so awesome. So I love it. Thank you so much for putting this together.
Can everybody online hear these questions? That's my question.
Yeah.
They can. Okay.
Yeah. Do you want to go first, or do you want me to go?
You can go for it.
Okay. I'll start with the mental health thing. So my transition of care, as Faith was speaking, she said when you're 21, and that's not always true for everybody. Sometimes it's 18, right? And conveniently, that's in my opinion, one of the most tumultuous mental health times already. So let's throw chromo on top of it, right? For me, I'll be honest, it was difficult. I stayed with Dr. Zhao until I was 21, but I turned 18 in 2020. And I was doing great. And so we were trying to see if I could get off the Humira and see if I was in remission. And unfortunately that didn't work out for me, and I had a really bad flare. And that was during the pandemic, and I was about to start college. Which was all online, all on Zoom. So honestly, I didn't have any extra mental health resources. I've never done therapy, or I've never done counseling. Honestly, what it's been is crying with my mom. And while maybe that's not always enough, maybe you do need clinical help. Understanding your resources and your insurance coverage for that is important. But I don't think that we should underestimate, if you do have the support system there, to lean on those people and to be vulnerable about how afraid you are. Because I was really afraid, and I didn't want to talk about it. And honestly, what ended up happening was I learned that I was strong enough to take on all of this. I didn't think I was, but I learned that I was. And I found success in that. But if you couldn't, if you're going to university or you get a job once you're an adult, a lot of companies and universities have mental health resources at their employees or students' disposal. My school, I went to Seattle University, and they have like what they call a CAPS program. They had on-campus counselors. So if this is a concern for you and you're a patient or you are a patient that's looking to go to school, maybe you research what schools have the mental health resources that you're looking for. And a lot of schools make sure that either that's free or they have like rules that all students on campus need to be insured so that they can access those resources. So that's what I did on the mental health front. I don't know if you want to speak to that before.
Yeah, totally. I think that mental health throughout transitioning definitely is connected. Mental health is interwoven to CRMO very heavily because it's dealing with such a challenging health condition at such a young age. Definitely takes a toll on you, and once you get older, you're just loaded on with like more and more. So it can bring some weight for sure. And so I think that as you are getting older and maybe you are feeling kind of the weight of chromo and all that it brings on you, I think definitely finding resources is like key and should be in your transitioning process. Whether that's through school, whether that's done through independently, independently, I think it should, definitely be prioritized because, if you're not doing well mentally, then the rest of your life is with pain on top is just, it's a big challenge. My school had kind of a counseling center. So if you're going to university or school, looking to see if they have those resources there is super awesome. If you also want to do it, outside and look for your own, counseling practice, like that is also, I think, a really great resource if possible.
If you have a problem doctor you trust, I imagine that they have access to some practitioners that could help. And I think asking those questions before your transition would be valuable just to have it, just in case. But also, once I transitioned, it's not like I stopped talking to Dr. Zhao at Seattle Children's overnight. It's not like I'm texting him because he's far too busy for that. But if I was really needing something and it felt like the care that I had was not meeting my need, I reached out to him and he would help kind of fill that gap. Now, not every practitioner is going to want to do that. But if you trust your doctor that you had during pediatric care, maybe they can help kind of bridge that for you. The medical gas study thing.
What I found that works for me is for schools, anywhere, is I call them and I try to build a rapport with the office and I say, hey, is there an email that I can just send you a couple of videos about this disease? And then I find the most powerful videos, like one of yours is one of them, and I send it to them. And it really helps, even with the schools, with different doctors and everything like that.
Yeah, absolutely. So second part of your question was about just having to basically justify yourself to these new doctors. So fun fact about my transition, I'm at UW Medicine now. I was supposed to go straight to Dr. Jenna Thomason, who Dr. Zhao has built a rapport with. But I couldn't get an appointment with her right away because you know how these things work. And so I got an appointment with the rheumatologist that trained her because UW is a teaching hospital. Grant Hughes was his name. Is his name. He's still around. And I went into that appointment fully loaded. I was armed and ready. I was like, here's the research article that I just read. Here's my community that I'm a part of. Here's my entire story. I have a short story and a long version of my story. If it seems like they're not really getting your details enough, I was ready to go. And he believed me. So he's a really good doctor. I was like, what? Because I've had a lot of rough experiences with people not believing me. And you talk about mental health, that's a really triggering experience. And so having to breathe through that is something that I've learned. But I think it's important to acknowledge that sometimes you're going to come in there with every resource you should have that you shouldn't have to have. Honestly, you should be able to walk in there and say, I need help. And they say, okay, cool, here's your help. But you walk in there with all of your armor, is what I call it, and they still don't believe you. That can happen. And so I've had times where I haven't been able to get the care that I needed, and I learned what worked for me so that I could keep going until I found somebody that did believe me. If I ran out of my medications, I remembered what I did before I was diagnosed. And I got those heating pads going, I got the icy hot out, I got the Advil on deck, and I was like, okay, this is what I can do. You know, I would ask my primary care provider, can I see a physical therapist, or can I, I'm having a difficult time moving in this part of my body, and physical therapy has been a tool for me in those moments if I can't get the treatment that I need. And I think having kind of your emergency game plan is a good thing to have. If you find yourself in a place where you can't find a system that will accept your need. Yeah. So that's what I would say about that.
That was
That's good.
tied up in a beautiful bow. That actually reminds me that it does, in this timeline, it does says what to do in a medical emergency, and that's not if someone's needs CPR, not that type of medical emergency, but more of your own personal medical emergency. What to do if you run out of medication, what to do if, your doctor is on, vacation leave or something.
It happens.
Yeah. So I think that was a really good point to bring out. So that was really great.
I wonder if there's online questions.
Yeah. Have you seen any?
See anyone raise their hand yet?
Oh, yeah.
Oh, there we go. All right, feel free to unmute.
Got it. Can you hear me okay?
Yes.
Awesome. We talked about your general practitioner too. Was that transition occurring around the same time, or did you do that separately? Or any guidance, I guess, or tips on that piece too outside of CRMO?
I still have my own the same primary care doctor that I've had, since I was little, thankfully, because I haven't moved around or anything. But that is also, again, I forgot to mention that as well, but having in the timeline on our little brochures, it's finding an adult rheumatologist and a primary care doctor. It might not seem super necessary to have both, but just when Braelyn said, when you need it and your primary care doctor is there, they're gonna have more foundational resources to kind of give to you other than the more specific resources. So yeah, I still have my own primary care doctor. Yeah, that is super helpful.
I've transitioned my care to an adult PCP now. I did that transition later than I should have. I was so focused on the rheumatology part of it that it was just too much. And I don't only see rheumatology, and I'm sure that's true for a lot of us. I have a whole team of doctors, and so I was okay, first rheumatology, and then endocrinology, and then dermatology, and it was too much. I think that first, there's, at least in our area and the medical system that I'm in, there's a shortage of primary care doctors. And so getting into it was almost harder than getting into rheumatology for me. But that doesn't necessarily have to be true for you. What I would say is that I would look into that first, or congruent with the rheumatology transition, particularly because of the disease environment that we're in right now, and that most of us have immunocompromised statuses. I'm concerned about a lot of things, and getting a primary care physician means that maybe I can get access to the vaccines that I wouldn't have before, and I can get better protection if that's something that you're seeking. So for me in my system, what's hard about this is so much of it is knowing my chart and how to navigate the behemoth of the medical system that you're a part of. So I had to figure out the right phone numbers to call. And how that happened was I just started calling phone numbers, and I found out which one was right and which one wasn't. And I have a little contact sheet of like, oh, I found somebody that's real with this one, or I got a robot 5 times with this one. So I started doing that on my weekends. It was super fun. And then for me, I was able to go onto the website, pick which location I was looking for, and then I would scroll through the doctors and I would be like, oh, that one, they look nice. Like, maybe I would like them. And then you just kind of have, it's like throwing darts at a wall. You just got to start trying. And unfortunately, I would say that's the hardest part for me. It's just how much energy it took. But if you're a parent, you can still support with that. I'm not saying that anyone should commit fraud, but my mom sounds a lot like me on the phone, and I've given them permission to discuss my medical care with them. And so she's helped me a lot through that as well. So there's permission processes that you can start. So as a parent, you don't just have to like all hands off, figure it out, kid. That's a big help for me too. But yeah,
Ask a follow-up on that.
Yeah, go ahead.
What did you find? So my son wanted to be here, but he's at a thing, can't listen in, so I'm taking some questions for him basically.
Okay.
Were there certain characteristics looking for that GP that you found, like, to know that that was a good fit for you or not? He's been with his pediatrician forever and loves her, and she's keeping him as long as she can.
Yeah.
She was instrumental in helping us find the diagnosis. And has been really like works very collaboratively. So we're hoping to get some recommendations, but the fit's so important. So I guess I'm just wondering if there were any like particular things that were clues for you that you knew like, okay, this is a GP I can work with, like when she started finding the ones that like looked nice.
So when I was being snoopy online, I just started with people that I felt like I could identify with, that would be easy for me to communicate with. That was like my first thing when I was going online. But when I had my first PCP appointment with an adult provider, I was interested in how much capacity for medical history they had. Were they like, so are you vaccinated or not?
Yeah,
whatever, bye.
Yeah.
Or was it like my appointment went great, so I got really lucky that I didn't have to trial and error too much. But this individual was like, I saw that do they review your chart before the appointment? Is a big one, because we have so much stuff. We cannot be expected to communicate all of this during a 15, 20-minute appointment. So that was like a green flag for me that she had read over my chart, but then she also asked questions about it.
Yeah.
She was like, oh, I saw that you saw a GI doctor when you were 6 years old, but you don't have another GI doctor yet. Is that something you might want in the future? Yeah. And that was like, oh, wow. So when I need a referral, you're not going to be a hindrance. You're going to be a help, right? So yeah, honestly, it's just like assessing their demeanor. And do they have the posture it takes to handle all that we have to carry? It's great. Any other questions?
Can I ask a question?
Yeah.
First of all, you're both amazing. Thank you for doing this. I think it's awesome for Lainey to see role models like this. One thing I'm curious about is you talked about on the timeline asking for private time with your doctor. And I'm just curious, you said 16 to 17, like, for other than asking for that private time, were your parents or a parent with you for most of your appointments all the way up until you made the transition, or did you start kind of attending on your own?
My mom still comes to mind.
Really?
Yeah.
Okay. Yeah.
Same.
Okay.
And for me, that was a conscious choice. My mom made it clear that it didn't have to be that. But getting diagnosed was such a process for us. I navigate this medical system with an extreme apprehension. And I found that it's a lot easier to deal with that medical gaslighting if you have somebody there to back up your story, or somebody there to show that you're a person that other people care about and you need care. Because I think a big part of this is people viewing you as somebody worth caring for, unfortunately. So that's how I've addressed that.
Yeah. For me, my mom still comes with me. I think that might look a little bit different, maybe for like some of the adult appointments that I'm gonna go to in the future. But yeah, up until I was out of, Seattle, I think for me it was more of the fact that my chromo was affecting me so much in like the exhaustion area, and sometimes memory wise I didn't remember a lot of the pain, like specific pain points that I was going through. So to have that second brain and second ears, second eyes to kind of see the experience that I was going through, that was helpful for me, because it would help recall like, oh yes, my ankle was extremely swollen, for 2 weeks or something like that. I think that helped just at least jog my memory. I know at least there's sometimes Seattle has done like surveys that they'll ask for you to like do by yourself. So like even like there's opportunities like that where they will give you time by yourself. But yeah, I think again you can start to do that in other ways by like making phone calls by yourself, or other ways like that. So,
And I just to jump in really quick as Faith's mom, I do think that it's important to always have a buddy when you go to a doctor appointment. Even as an old person like me, Lainey, it's really important for me to have somebody with me to be able to be a second set of ears. So even as you get older and you're like, okay, my mom and dad aren't at the college that I'm at, it might be good to just bring a friend anyway. Because if you go, it's always so much better to have, you might hear something, or you might be going, oh, you'll be thinking about something while they're talking. And to just have a second set of ears is always good.
Yes.
So bring a friend, or, bring somebody who's important in your life, who's always going to be there for you. Bring those kind of people. Grandma nearby, or whoever. Libby might be nearby, and I'll come to your doctor appointment with you. Whatever. Just a second set of ears is always good.
actually, I did do that once. I brought a friend with me, so
Yeah.
it was, and it helped. Yeah, just helped jog my memory with some things.
Yeah.
We received. If you want to unmute.
Hi. So I just wanted to kind of add to the conversation. I'm one of the CRMO parent advisory members and guild members, and my kiddo Astrid was the in-person conference a couple of years ago. And so we're also in the process of navigating this. Thank you both for sharing your information. Astrid's just a few months younger than you all. And so I just wanted to add some things that we've experienced that have been helpful for folks in the call. So Astrid is in college in Boston, and so had to transition into new providers as well as keeping providers. So Astrid has Boston providers and still has Seattle children's providers. And so we have had to navigate this cross communication back and forth. But one of the things I would encourage for families is when you first transition your kiddo to college, especially if they move out of state, keep a touch point with your Seattle children's providers for a while if you can, until they're aged out. So like Astrid, for example, flew back to Washington and saw Dr. Zhao in January in person, even though Astrid has room in Boston. And then just this week met with room in Boston at Boston Children's to talk about the other rheumatological and conditions, and then relay the plan. So that would be one. As long as you're able to, and if your insurance will allow, I would try to keep an annual touch point with Seattle Children's until you age out. Two, like they said, there's so much value in my chart, even after you age out or transition to a different care provider. as long as your My Chart's active, you can still have that touch point and that reference or collaboration, like, hey, is this right? Also, if your child is away from you, it is okay to ask. You have to ask the provider, but it's okay to ask for you to be FaceTimed in to the appointment. So, like, for example, I join Astrid's medical appointments, quite a few of them, on FaceTime. So Astrid just brings an iPad, sets it up, and then has their in-person appointment, and they FaceTime me in. And most of the time I stay on mute, but I'm there for almost every appointment. There's a point where there's a historical question that comes up about childhood when they were little that Astrid can't answer. So that's your way in if a doctor is kind of hesitant and doesn't want to do it. Offer to say, hey, you can put me on mute so I'm not talking and interrupting, but I'm there in case the resource is needed. So I encourage, even if they don't allow a telemed, your child has the ability to authorize you to join on FaceTime. And then with that, just to kind of encourage people, I mean, we have this idea, you both brought it up really well, about bringing a parent with you or a friend with you. You see it as people age. So, like my grandmother, for example, brings a family member because people recognize she might get overwhelmed and forget things or not ask all the questions she should ask for the appointment. You do the same thing for children, but it seems like when you hit like 18 to, I don't know, pick a magic number, 80, you're supposed to do it alone. And that's really not the case. So I work in patient advocacy also. And that's the thing I try to tell people. Every person has the right, no matter what age you are, to bring someone to an appointment with you. And if you're going into a cancer diagnosis, the expectation is you're probably not going to go alone. You're going to bring someone. So the same should be true for any medical appointment. You have the right to always bring a patient advocate or a second set of ears with you. And I wanted to share, that was the most important thing I wanted to share, is do not feel bad leaning into that. And it's actually an empowerment piece to just have the extra person there, have that resource, and just kind of make it a best practice. Even if someone just drives along with you and they're there going back and forth, but really and truly encourage people to go ahead and still, it doesn't have to be your parent forever, but bring someone with you. And like you guys both said, bringing notes, filling out, taking a log ahead of time, especially as you move into adult care where they're a little less gentle and they move quickly, having data-driven information that says, here's where my bone pain is. I'm having headaches. I'm having light sensitivity, GI issues, skin issues, whatever it is. If you need them to make a referral, whatever, having the data about it, snapping photographs of things. Wow, these joints swell. Take a photo so you can actually show them the photo. It all helps with medical gaslighting. Like, it's all so important. Every piece of data you can give them, it helps shut down those things. And then the final thing is, do not feel bad about firing a provider. If they are gaslighting you or they are not supporting you, they're not assisting you, fire them. Like, I literally last week fired one of my own doctors. I got assigned a new doctor and they completely ignored my history of cancer diagnosis. And so I fired them. I was like, I'm not doing this. So do not feel bad about finding the right person that works for you. So those are all just my tidbits. But thank you both for all
Marcy.
your info too.
That was great.
Can I piggyback really quick off something Marcy just said? Is that I think as parents in the room, if as our kids are transitioning, it's really helpful, I think, to something that you mentioned was you had a short version, kind of like an elevator pitch of your diagnosis, and then a longer, more detailed one. It's actually really helpful, I think, as parents to give your kids like a history of what exactly happened. Sometimes we have a different perspective. They're living the experience, and for us to be able to give them a little elevator pitch of what we saw in their life, and then maybe a little bit more detailed, that will give them data as well moving forward. They have a kind of a unique external perspective coming in on what happened. Like Faith mentioned, she couldn't remember certain things, but boy, I think that it would be really helpful just for her to have my vision of what happened during that time. Like she had a lesion here, she had a lesion here. She doesn't remember a lot of those specific things. It's important for us to be able to help give you guys the data that you need. What Marcy say?
Putting a Google Doc in their phone with their medical history is helpful. We also keep one with all the medications and family history as well.
Absolutely, Marcy. Good point.
Hi, so I'm in the UK.
Oh, awesome.
So So ours will be different to yours, but I'm really interested. My daughter was diagnosed when she was 3. She's now 14.
Okay.
So um, so she's started that transitional process into adult care. She's got a really good team around her, but I was just interested in what you guys do, and if there's anything that we can take back to our teams and say, we think that this might help.
Okay, awesome. We're working through like a little brochure that we have here that you'll get access to towards the end of the thing. But we were discussing how if like your young chromo individual, they got diagnosed early, so they can start the transition gradually. And so we were talking about how certain steps you can take is like starting with knowing your symptoms and your doctor's name. But then it can progress all the way to like knowing the details of your insurance. Well, I know that system is different over there, but still like knowing your identification methods within the system is important, and knowing who to reach out to when things go wrong is also really important. So honestly, since we're going cross-cultural here, I think like the thing that can be universal about this process is learning how to speak about your condition effectively. I don't know if it's necessarily a concern for you, Lisa, in finding care individuals that know what chromo is, one, and are able to treat it. I don't know if that's a barrier that you're facing right now. But in our first breakout session, we talked a lot about how to deal with the term medical gaslighting was used, but just individuals not believing you that this is even a real thing to begin with. And so we talked about how to work through that and how to know when the right time is to say, like, I'm not dealing with this doctor anymore because they're not hearing me, and being able to say that and make that choice.
It's interesting that you bring that up because we recently transitioned from a primary care physician, pediatrics within like Providence, which is a big place that has lots and lots of patients and maybe less time, to a naturopath. And I had a way better experience with her, just hearing us and having more time and helping us advocate for the things that she needs and being able to manage her care.
Yeah.
That doctor in the pediatrics really didn't seem comfortable managing her care and would just want to pass it off to someone else. I'm like, well, the rheumatologist doesn't really want to help us get her like tested for ADHD or or like other things that would like that are not necessarily trauma related.
Yeah.
So really having one doctor that would help and still realize that obviously she needs like major medications. Like the naturopath's not gonna like, oh, stop taking your Humira. Like,
Yeah, I think that's a great point, because a big part of the transition to care, we talked about how, like, for me, I was really focused on the rheumatology side of it. I think I was a little, like, single-minded in that. But the transition is also about finding your ecosystem again. And so making sure that you don't neglect finding your dermatologist or your primary care provider or your endocrinologist or whatever, and making sure particularly that your primary care provider is able to connect you to the resources that you need instead of being a barrier to those resources. All of those things are a part of the transition, and sometimes at least I forgot to think about that stuff. So, yeah.
I think one thing that has been, at least from the past session, and that has really hit home, I guess, with me, that I feel is really important to mention, is that throughout your chromo journey, you're just trying to find as many resources and put them in your basket as much as possible. So I think a lot of the times we're like, oh, one single doctor is all I need to, help me get through this journey. That could be true for some people, but I think having a team and, again, you're just like collecting coins almost. You're collecting gems and keeping them close to you, I think is really important. And just building that team, throughout from being a kid all the way into an adult is really important. So just making sure that your community is, of doctors is there for you, and knowing that they're good people and that they're going to help you and you feel good about them, that is a huge success. And it takes, time and effort and patience to maybe sift through some people. So yeah.
Honestly, I think a valuable part to work through is like this little pink part on the open trifold, which is like really analyzing what you want out of your care providers, and doing that for yourself, like analyzing what you liked about your pediatric care providers and what you would like to see continue on, or maybe something that you feel like your pediatric care didn't address that you would like to see addressed. So we have like the questions: what kind of adult provider do I want? What should I ask my current doctor before I move away from their care? Like, if you're moving to a system where their systems aren't compatible and they can't just send your whole medical chart over, make sure that you can get that done. We also have is my future provider in my insurance network. That's always a thing. You think you find somebody that's going to be great. Everybody on Facebook page says they're amazing, and then you look it up and your insurance is like, we hate you. No.
So then you change insurance.
Exactly.
We
If you
change
can.
insurance to get her on Humira.
Yeah.
That was a pain in the ass to change all 3 of my kids.
Oh my
gosh.
What the heck?
But we got it.
Yeah.
Woo! After 9 months.
That's really real.
That's a long wait.
We had to appeal twice for my Humira the first time. It was so awful.
Yeah, after 2 appeals, we changed insurance.
Oh my gosh.
I think really important. As a kid, here, kind of, my mom also, I was 4, and then now I'm 21. I've had chromo symptoms all throughout then. My mom sometimes would tell me some of those things, being like, oh, like, hey, like, I'm having to appeal for your medication right now. Like, hearing those things from my mom was like, gave me just like an insight as to what it was going to look like for me as an adult. So I think even though maybe it's a really difficult and like challenging process, including
hiding it.
Not hiding it is really valuable.
That's
I mean, it's going to be your life.
Push for what you need and fight for that. I mean, I still have to order it over the phone once a month, and then I have to sign for delivery, so you have to be there all day. Sometimes I get notifications coming, sometimes I don't. And I'm like, that's kind of scary if we miss, if it doesn't show up.
Right. Or if your medication needs to be refrigerated, like how do you dispose of it? Like all of those things, it's totally important to just even like think about and to be involved in. So I think that's really what we were just trying to hit home on is with this brochure is how to get involved with your medical care and kind of preparing to take it on by yourself, because that's eventually what's going to happen. And so thinking about things, communicating, like all of those, really foundational key points are what's going to make, your transition to adult rheumatology and your adult medical care a lot easier.
My mom, I didn't get diagnosed till later, but I had stuff all throughout my childhood because I had chromo the whole time. And so what my mom would do was, like, if she was having to fight an insurance battle or call to even just make an appointment, she would have me sit in the room with her while she was on the phone, and she would have it on speaker so that she was mirroring to me, this is what you do when you're calling an insurance company, when you're calling the doctor's office. And so that way, like, when I finally got to Seattle Children's and they were like, name the date of birth, that was it. Braelyn Scheer, 12/25, 2001. Like, I was ready to go because I heard her do it a million times, right? And so the same is true with like finding the demeanor you have to hold in order to break through those bureaucratic systems sometimes. I learned how to be mean in a way that they weren't going to flag my profile, right? Because sometimes you have to do that. Or nice in a way that was going to make people hear me better. And all of those things are learned skills. You can't be expected to know them once you're 18. So I think she started that when I was about 10.
Oh wow! So what about that process took so long to get the diagnosis?
For me?
Yeah.
Well,
Not the right person, not seeing your MRI.
I didn't even get an MRI until I was 16 years old. So I I had a lot of broken bones when I was younger. I had a lot of like going to physical therapy for random things. Like they told me once that I have this thing called Sever's disease in my right heel. I had terrible bone pain in my right heel. And they were like, oh, it's your growth plate. Your growth plate is growing weird. And it's this thing called Sever's disease.
Have you been to Children's before, or was this somewhere else?
I had been to Children's for other things, but I live south of Seattle. So Seattle Children's was an extra thing that we started doing once my symptoms started to get more intense. I was in the Mary Bridge system first, which is in Tacoma.
Okay.
And honestly, I don't think those doctors down there were equipped. And my mom knew something was wrong, and they told her she was wrong. Is what happened for a long time.
So my husband is a chiropractor, and I think that his presence and him advocating and him demanding that there was something wrong.
Yep.
And that I know that this isn't right, and you will do something about it. Is really what pushed her through so fast.
Yeah, I agree with that.
She's like went down a slide when she was like 5, and her tailbone was like killing her. Excruciating pain for like 3 hours. 3 hours later, she's still like in tons of pain. Had an X-ray, and somebody saw something on the X-ray that said, "Oh, this doesn't look quite right." Who had just taken class on CRMO. And then they got an MRI.
Wow.
And like that so fast to go those processes. But I think a lot of it was because of my husband. And in the last class, there was a young mom who's felt that she's been basically discriminated against and not believed because of like her age and status. And that's so frustrating. I mean, I'm thankful for her that she got that because her dad is who he is, but it shouldn't have to be that way.
Yeah, it was really hard. My dad struggles with all this medical stuff too. He traveled a lot when I was young, and so my mom had to take me to these appointments herself. But if it was really bad, we would call it bringing in the cavalry.
And why is it that just having a man there changes how they treat you? It's terrible, but it's true.
Absolutely. So, yeah.
I think I want to piggyback off one thing that you said. So as we're talking about like having to stand up for yourself, I think that finding the confidence through your medical journey to eventually maybe having to take that one day is like so important. Like luckily, I feel like I haven't had a super intense experience where I've had to like truly fight for myself, thankfully. But knowing that that is a possibility with such a rare disease is very possible. Like the possibility of that is totally out there. And I've had my fair share of experiences with teachers and professors, not really bending to give me the accommodations that I need. I've experienced that personally. So I think that as a kid and as a teenager, that's probably the first kind of little glimpses that you'll see is you'll be like, oh, I missed this test and my teacher's not going to let me make it up because I had an infusion that day. And you're like, that doesn't make any sense. Or maybe I have, I don't know, something else, or I have a doctor's appointment that I have to go to and I can't get off work or something. Like things like that you'll get glimpses of. And so I think really just building up confidence in yourself that you know your own body and you know your body best, and to advocate that you are going to be your biggest advocate, and using your power within that to really make your own trail and blaze your own path, that's going to be what's really important. And of course, having your team around you and your supportive community is going to be, your number one go-to for if, it feels dealing with chromo is so heavy and can be, such a weight in your life. So having your community, having your parents, having family, friends, anybody around you, who is supportive, you want to keep them close for sure.
There was a time for me when I was younger. I wasn't diagnosed yet, but I was just sick of the appointments and I didn't want to do it anymore. And it felt like something I had been burdened with. And so I responded to that by just kind of trying to check out. And so my mom helped kind of break it down for me and make it more accessible so that it didn't feel like this mountain I had to climb on my own in a day. But instead it was like, okay, just take it a step at a time.
Yeah, we're experiencing that kind of feeling as well with the burnout, with the appointments, with the I don't want to do this anymore.
Yeah.
When is this going to be over? That kind of sentiment as well.
Yeah. And I don't know, it's one of those things for me. There's always still a part of me, like when I see an appointment notification come up, I'm like, oh my God, like I don't want to do this. But I learned the power of taking care of myself, and I felt what happened when I didn't do that. And so I decided, okay, well, I can buck up and get over it instead of neglecting myself, because that's not going to fix any of this. So I'm happy to hear that you guys are starting to take those steps, and that's kind of what the brochure is talking about. It kind of breaks down like all the way from 12 and 13 to like 18 to 21, and the progression. Like, we're not going to expect a 15-year-old to be able to explain the medical system and how insurance works to us, but it would be nice if they knew what an insurance card was, and things like that. But yeah, are there any questions that you guys might have for us? I can reintroduce myself too.
Yeah, let's do it.
My name is Braelyn, and I'm 23 years old. I'm fully transitioned into adult care now, but I was diagnosed with chromo when I was 17.
Cool. And then I'm Faith. I am 21, and I was diagnosed with chromo at 7, and I just transitioned about a month ago.
Yeah, so we're just kind of talking about the steps that we take, and the things that we learned as we were going through the medical system throughout our teenage years to prepare for our transition. And if you guys have any questions for us, feel free to interject and ask.
What has been your biggest challenge in transitioning between pediatric care and adult care? Like, what should we be really on the lookout for to kind of smooth that navigation out?
Okay, I would say there's the bureaucratic side, and then there's the personal side. So personally, you have to deal with a lot of feelings. Dr. Zhao at Seattle Children's saved my life, gave me my mobility back. And so honestly, he's also just a super awesome dude. So I liked him being my doctor, and I wanted to hang out with him, and I was gonna miss him and his care team, because it felt like I had finally found a place where I wasn't just a patient number, I was a person. And so I had to kind of grieve that loss. Now, if that connection isn't there, then cool, we'll just transition. But the second hardest part for me has been when you're in a certain medical system, when you're in the children's medical system, you learn the right phone numbers to call, you learn the people at the office. I know who the head RN at Ruth and Dr. Zhao's office saved my life too. And so you have to relearn all of that. And they're not as nice, they're not as frilly, they're not as happy. And so you have to kind of put your big girl pants on and get to it. So what was hard about it was just the trial and error of that. So prepare yourself for, honestly, the hard work and time that it's going to take. It's going to take more effort than it should. But also, you said things to look out for. You also need to transition not just rheumatology, but also all of your other physicians, right? So you need to be on the lookout for, this is a conversation we had in the first breakout session, be on the lookout for a primary care provider that will be an asset to your care journey and not a hindrance to your care journey. Be somebody that can bear the load of such a lengthy medical history, even though you're like 20 years old. And that doesn't always exist. And there's also a shortage of primary care providers in our country right now. So you have to be really diligent with like getting on that quickly so you don't get shut out of the system before you need it.
Yeah, I completely agree and double everything that Braelyn just said. The first thing that came to my mind with preparing for transition is really, I think, just building up the confidence, like to take on kind of this really big load that you're going to then carry with you for the rest of your life. Because even like, I don't know, I feel like I've had quite a bit of practice since I've been dealing with symptoms since 4 years old. So I've had to talk about it a lot. I've gone to a lot of doctor's appointments. So I've had the chance to, get to know the system and to get to know talking about the condition that I have. But some people don't have that chance, or they just really don't feel confident in, accepting that part of themselves or like talking about it to other people. So I think for me, and what I would share and suggest is just building the confidence and knowing that you know yourself, you know your body, you know your disease. You are going to know that best, better than anyone else on the planet,
Even
except
if they're super smart.
yeah, even if they're super smart. I think that's why the conferences are such a great place, is because you actually get to meet people who are dealing with the exact same, if not very similar thing that you're dealing with. So
Yeah.
just confidence in your future and in your care, that you know what's best for you.
Got some really basic questions for you two. So our little guy, not so little anymore, but he's 15. So I think he still has a little bit of time in the children's scene. When do you get kicked out?
So we both held on for as long as we could. So there are waivers that exist out there. And so we both stayed in pediatric care until we were 21. But we had to start that conversation when we were about, for me, it was 17.
I don't know if it's earlier for me. I think I knew that I could only be at Seattle Children's for, until I was 21. Other places it might be different. It might be 18 in some other places. So I think knowing when that is a really great piece of information to have wherever you are. And then, doing the work behind the scenes.
It's bureaucracy, so you gotta kind of.
Can you give a little sense? So we are local, so we do see Dr. Zhao. And so tell me a little bit about the process. How do you start? When would you suggest starting?
The brochure kind of touches on that. And in the brochure, kind of say like 12. Because so much of the transition process is one, knowing your condition, knowing your medications, knowing your symptoms, knowing your medical history. All of those things are things that take time to learn and take time to remember. And so the more time you give yourself, the better. But yeah, I mean, since you said 15, right? So I think now is a great time to start discussing things like, where do we get our medications refilled? What medications are we taking? How often do we take them? Like if they aren't managing their own meds, maybe that transition could start. If they aren't managing like ordering medication, if it's mail order, maybe they could sit in on some calls or something like that. I think those would all be good things to start doing.
Yeah. I think it's also important to remember that transitioning is not linear. It's not, it's going to look different for every single person, because you might get diagnosed when you're 32. You might get diagnosed when you're 3. Like, the differences are pretty intense. There are a lot of resources though. So the brochure that we're using today, I created just as a really simplified version. We'll send this out afterwards, but it is a compilation of information from Boston Children's Hospital. They have really great pamphlets just on how to prep your child to, take on, their own medical condition and their history. So doing, just searching online for any other transitioning help. I even there's checklists I've seen, there's, question lists, there's worksheets for kids that they can do online. So resources are out there for, if you want further help and support. But yeah, I mean, at 15, you're getting to the point where you can kind of handle some of the tougher information that might not be quite so accessible to a 8-year-old. So knowing your own medical history, knowing your allergies, I think kind of taking on some of the responsibility to call for your medication refill, call for your appointments. You can start doing that, I think, around that age. But yeah, again, every person is different, and literally anything that they can do, at whatever age, is going to be beneficial to their adult experience.
Yeah.
That's super helpful. Thank you both.
Yeah. And I was just going to tack on here. If you don't know what medical system you want to transition to yet, totally cool. But at least when I transitioned around 2022, Dr. Zhao was establishing relationships with practitioners at UW Medicine. And so I also have a thing that I didn't print out, but if anybody that's local and is transitioning to maybe UW Medicine needed, my doctor there, Jenna Thomason, is great, and she created resources about transitioning specifically to the UW system. So if that's something that you want, then that's totally cool. Maybe you could reach out to Ava and she could provide you my contact information and I could share it. But yeah, UW and Seattle Children's are really well connected, and they communicate well with each other. And so that makes the transition of medical records and my charts really easy. And they also still use my chart there too. So I didn't have to relearn those systems.
She actually also,
Thank you.
Yeah, Dr. Thomason was actually at the conference last year, and she gave a talk on transitioning, which might still be a recording available. I'm sure if you just reach out to Ava, she might be able to pull that out and give it to anybody if they'd like. Yeah.
Any other questions for us?
Feel free to type them in the chat too.
Maybe we can go through the checklist. Yeah. So on the back of this beautiful brochure that Faith has constructed for us, it has a preparation checklist. And I think it does a really good job of simplifying such a massive work into a very simple checklist. So the first one on here is talking about whether or not you can describe your medical condition to somebody else. And I think knowing your audience with this is important. There's a difference between describing chromo to your doctor than your grandma or your friend. And so if describing it to your doctor seems daunting, or it feels like maybe they won't hear you, or they don't know about chromo and you don't have the right words to kind of advocate for it, start with talking to a friend about it or a teacher about it. Because then, using plain words is always easier than the big words. I remember when I first got diagnosed and I'd be like, chronic recurrent multifocal osteomyelitis, and then people would kind of drop, that's a big word, a lot of them together. So maybe starting without the big words can make that more accessible.
Yeah, I feel like that's really important, is knowing your audience. Which, I mean, as a kid, if you're diagnosed as a as a child, that is all you're going to know, is you're going to know the simplified words. So I think that's a good point to make. And it just makes it, keeping those simplified words, I think, help everyone else as well. Yeah, I mean, I remember throughout the years, it does get easier for sure. It might feel really scary and daunting at first to talk to people about it. I mean, I remember just being so afraid that, I was going to get judged, or I wouldn't be able to say it the right way, or I'd say it wrong. But the more you do it, the more it becomes easier. And I think just sharing that piece might be reassuring for some people, for sure.
Yeah. And then the second one we have on here is, do you know the medication and or equipment that you use to manage your condition? And that can, we all need, when you transition your care, you're going to need your prescriptions to be re-upped. That means new pre-approval processes. Their office for me over at UW has been great, but I will say that sometimes they seem a little more afraid to ask insurance than they are over at Seattle Children's, where they've learned more avenues to navigating that pre-approval process. And so knowing what your medications are, knowing, hey, my insurance doesn't like when I take this one, so it's gonna be an uphill battle, and being able to communicate that to your doctor, I think, is important. But also, like, knowing your medications and their side effects and how that affects you, and so you can plan your schedule around, like, I always take my methotrexate at night because it makes me really lethargic, it makes me feel some pain, and I don't want to feel like that throughout the day, so that's when I plan to take it. That's a conscious choice that I have to make, that my mom used to make for me. Also knowing, like, the equipment that you need. So we've both used assistive devices like crutches or wheelchairs. If you need that and you're in a workplace or a university, like, anticipating, communicating with individuals, knowing disability accessible routes around different campuses that you might be on, all of that is work that you kind of need to start doing. Yeah. You want to talk about number 3?
Yeah. Number 3 on our little checklist is, do you rely on your parents to speak with you while meeting with your doctors? And that, I think, is probably one of the biggest hurdles to come over especially a pediatric care situation, being able to get to the point where you can speak on your own and share your experience. We have mentioned that going to doctor's appointments with your mom, with your dad, with a friend, with anybody, a second set of ears and eyes comes with so many benefits. And so even though that second person is there, they don't have to necessarily always talk for you. You definitely can share your own experience and what you're going through and experiencing. And it is important, because there might be times where, that person can't be there, or, maybe you are experiencing it. So you're going to have to share the pain or the whatever you're dealing with, because you're going to know it best, for sure. And that can range and begin at any age, whenever you feel that confidence enough to speak up for yourself. And I think as a role as a parent or the caregiver, just encouraging your child as much to go ahead and take that role and give them the time and be patient with them to take that step and that leap is going to be really vital in their adult process, for sure. So starting that whenever is a huge help, for sure. Yeah. Number 4 is, can you set up an appointment by yourself? I personally remember my mom, she would pull up on her phone, she would type the number in and then put it on speakerphone and say, all right, you're going to do the talking. And this wasn't until I was in high school. So it is a difficult, definitely, it's a big machine. Hospitals are big machines, and they can be scary to jump into. So having support and help is always going to be helpful. But yeah, doing that when you feel ready, maybe in that high school age, you can go ahead and start to maybe do that yourself, because then you're you know that you can take care of yourself by doing that. You can, when you have pain, you can be like, all right, I know how to do this, and I can go ahead and make a call and ask for help, because that's how us chromo patients are going to get through the world, is we're going to get through the world with help and support.
And then that last one that we have on the checklist is, do you understand how insurance works and how it affects you? And I think we say how insurance works lightly because these systems don't really work, but like understanding how they apply to you and how you have to navigate them is important. Like finding a doctor that's in network, like, do you know what in network means? Are you able to understand what a deductible is and a max out of pocket is? How are you going to be checking on medical bills and who's going to be paying those medical bills? Having those conversations with your family is important, especially because, you know, we have the opportunity to still be on some parents' insurance until we're 26. And so, you know, conversations about payment and bills is not fun, but something that needs to start to happen once that transition happens. You don't want to find out that there are bills by a collector call, right? So discussing it beforehand is important. And then knowing how insurance affects you. I mean, you kind of have to get good at reading the news and keeping up on how our medical system is changing, because it changes every day and it feels kind of indiscriminate sometimes. Knowing, you know, like your policy is either re-upped or changed every year. Make sure you have the current cards on you. All of those things they were honestly kind of the hardest part. And so my heart goes out to everyone that has to make those transitions, but it is doable, and hopefully where you're going to has transparent financial health information, transparent, you know, access to maybe state benefits, all of those things exist. So just starting those conversations, maybe it could start with like, you got an MRI and you get your explanation of benefits and you just go over what that means, would be a good place to start, I think. So yeah, that's the whole checklist on there. Super easy.
When do you think the transition to insurance, your own policy, right? He's under our policy, but we know that won't last forever. And, you know, we do keep our ear to the ground, you know, with hearing news, you know, what changes might take place. And it is a big, scary, ominous thing. And thinking about, you know, gaining employment that has insurance, and, you know, it's pretty overwhelming as a parent. And I can't imagine how it feels as the patient, right? For you two. So I know you're both young, and so, you know, maybe you haven't had to, you know, deal with all of that yet, but definitely feel for you, and super impressed with what you two have accomplished so far, and that you're willing to be teachers to us. But yeah, it's a big, scary world out there.
Yeah.
Yep, that's for sure.
I appreciate you saying that.
Thank you.
Yeah, the parents in the chromo community, like, I could cry about it because I just, okay, I'm not gonna cry. But oh my gosh, the pain is so bad, and then you add this awful system on top of it. It's insane. And there were times in college during my transition where things moved slower than they needed to because I had finals and I had work and I couldn't get to it. And my mom was still able to help me kind of make appointments or pay bills or fight a claim that we didn't agree with and things like that. I made sure, because I trust my mom, and, you know, this might not be the case for everyone. Maybe they don't want to share this care with their parents as they age up, but I know a lot of chromo patients are really close with their parents. And if they trust them, then there's paperwork that you can fill out that says that, you know, they can leave a message for your mom or your dad about your medical care, or if they have billing concerns, they can call you, or you can call on their behalf and they won't say like, hey, this is an adult, leave them alone. So in those first transitionary meetings, if you can be in those appointments, then it's good, because my mom always says, like, I'm not here to babysit, I'm just here for when she needs me. Because I've had those flares where it's literally like I can't form a sentence, there's too much pain. And life is stressful, and stress causes flares. So we're not going to act like they're not going to happen, we're just going to prepare for the worst case scenario. I remember though when they were voting on trying to get rid of the Affordable Care Act, and I don't have to get into politics, but I watch C-SPAN religiously, and I think that's something that it's kind of funny for a teenager to have to do, because it was literally me figuring out whether or not I was going to have insurance throughout college. So, you know, I am somebody that always advocates for making sure that you're paying attention to your government and how it's impacting your life. And so, you know, I would say it's really good to know your news sources that you trust and to pay attention to them, know your representatives and call them and advocate for yourself, because unfortunately all of that does impact whether or not we receive care. So, yeah. Well, I appreciate you all being here. If you guys have any more questions for us, feel free to throw them in the chat or unmute.
I think we've got about a little more than 5 minutes. So, yeah. Any last minute questions?
Totally not related, but this is the first time that I've heard people call it CRMO.
Oh, really?
Over here on the East Coast, it's just CRMO.
Oh, interesting. Yeah. A lot of times when I say chromo, and then like I've had friends spell it CROMO, because that's like chromo, that's how you like actually would probably spell it. But yeah, I guess using, yeah, I don't know.
It's a fun name, right? It's all the same thing. It's kind of funny to me though, because I remember one of the first times I went to this conference online, they were including CNO and SAPHO, and in the adult world, SAPHO is kind of more recognized than CRMO is. And so there are all these different names, but I think that's just rare disease stuff, right? Like, call it what you want, I still have it. Are you in the
Well, thank you for everything. Appreciate y'all.
Yeah, of course. Thanks for coming.
Yeah. I think everyone's headed to lunch after this, right?
Yeah.
Yep. Like a break for them.
Yeah.
Cool.
We got Dan's State of the Research.
Yes, I'm so excited.
Wonderful Dance Integration Center.
Yeah, he's my favorite. Oh my gosh. What a good guy.
What other breakout sessions did you guys get to go to? Because we didn't get to.
So pain management, was a helpful one, right? Just helping people understand that it's not just biologic medication, and the way, pain is real, right? Whether it's related directly to chromo lesions or something else. And so that was, it's just helpful, I think, for parents and patients, to recognize all of the different, legs to that stool. Yeah, that was super helpful. And then the advocacy and accommodations, for those that are a little bit younger, like having a padded chair, in school, right, is super valuable for a kid where, the plastic chairs that are in high school, it just does not work when you've got chromo lesions in your hips. And so anyway, it's, it is a learning process. He's been dealing with it since he was 8 and he's 15 now. So he's been, in the saddle for a lot of years and learned some things, but is definitely over it. Right? So,
Right there with.
Yeah.
I'm
you
happy
know,
to
I came
get.
in when you were mentioning like the burnout, right? Medication burnout or appointment burnout, and the care for yourself, how you've learned that definitely goes hand in hand. That's something that, I think about a lot, is when he goes out and does his own thing, like we're not going to be able to be like, hey, did you take your medications? Have you had your movement today? Like, are you working out? Are you exercising? I know it's going to be a little bit of a probably guardrail to guardrail, right? Where we might just be like, no, not going to do it. And then experience the pain of not having done it and coming back hopefully somewhere to some middle ground. But whew, it's a lot for young people.
Well, we'll figure it out, and I hope the lessons don't have to be learned the hard way, but sometimes they are, and then they stick better, right? So, I'm hoping that, everyone, all the kiddos are healthy and they take care of themselves and they learn the value of that self-care. And, also, I just wanted to throw it out there, and I'm sure Faith agrees with this. If you ever want somebody to talk to, like if you think it would be valuable for your kiddo to talk to somebody that maybe has gone through it before, we're here.
Oh, totally.
So,
Yeah.
for sure. Yeah. But
Great. Yeah, we appreciate it.
yeah.